I'm really excited to be here today with Dr. Dave Stukus. He's a pediatric allergist and the social media editor and host of the podcast for the American Academy of Allergy, Asthma, and Immunology. Dr. Stukus, thanks so much for being here with us today.
It's my pleasure. Thank you.
So, Dr. Stukus, there were recently updates on how anaphylaxis might be treated. This was published as new practice parameters for healthcare providers. What do patients and caregivers need to know about these changes that were really, published as practice parameters for the providers?
Yeah, I think it's important to note where this comes from. So this was after a review of all of the published evidence to date. So hundreds and hundreds of different studies and review articles and things like that were looked at in regards to the strength of the evidence supporting these recommendations. So this isn't just a group of folks sitting around a table offering their opinion. This really comes from what the evidence shows. And the good news is the evidence shows that when it comes to anaphylaxis, it doesn't necessarily have to be as scary as we once believed. The majority of folks who experience anaphylaxis will improve very soon after receiving epinephrine. So that's why we want to promote using epinephrine, which is the only first-line treatment for anaphylaxis. It treats all of the symptoms that can occur. And for definition purposes, anaphylaxis is a rapid allergic reaction that involves more than one part of the body. So any combination of hives and swelling combined with vomiting and nausea, you can have coughing and wheezing. Some people can have severe episodes where they actually, have low blood pressure and pass out, or they feel, this impending sense of doom. So it's going to happen pretty fast after exposure to an allergen. You're not going to feel very well when it's happening. Epinephrine is going to make you feel better almost always. So one of the new recommendations is we'd much rather have people use their epinephrine if they're at home and monitor for the next 10 or 15 minutes to see if symptoms resolve, which they often will, rather than not use their epinephrine because they don't want to go to the hospital. So old recommendations were every single time you use epinephrine, you absolutely have to call 911 or go to the emergency room for monitoring. Well, it turns out most people get better pretty soon after using their epinephrine, especially if you use it early. That being said, for anybody out there who's not comfortable with those recommendations, if you're outside of the home setting, if you haven't had this shared decision-making conversation with your own allergist, by all means, go to the emergency room or call 911 if you're experiencing anaphylaxis or you use your epinephrine, or if you use epinephrine and symptoms aren't getting better. It's really important that you seek medical care to make sure that everything goes well. So that's really the biggest change. I know it's caused a lot of sort of consternation amongst allergists and even patients, but if you take a deep dive and understand what this means, it really is patient friendly. And because we want people, we want to promote using epinephrine as much as possible when somebody has anaphylaxis, but we want to remove the fear associated with that treatment. So that's where this comes from.
And that's really helpful to know because we always hear about, barriers for using epinephrine in cases where people aren't sure, or maybe, like you said, there's fear of using it. So I'm really hopeful that some of these new practice parameters, as we share them with patients and caregivers, they'll kind of reduce that fear, like you said, to use epinephrine when it's needed.